that simple of a process to get started. My team will respond. They're actually working right now, so we can get you set up on a consultation. The Retatrutide, by the way, if you're curious about Reta, the reason why everybody's so excited about Reta is because of the triple receptor action. So Retatrutide is a peptide that includes an additional receptor. So it's like an upgrade um, on top of Tirzepatide. And I'm currently on Retatrutide and AOD, and I definitely like the difference. It's an awesome peptide. I'm on Reta and Terz. What can I take for muscle when I work out? What doses are you on? Because most people I've seen they have the dosing all kind of wonky. So as far as muscle mass, nothing is going to be more effective than implementing targeted lifestyle interventions. Targeted lifestyle interventions, without a doubt, most important thing. But if your training is dialed in, if your protein intake is dialed in, then we can talk about growth hormone peptides like Semorlin, Tesamorlin, CJC, Ipamorelin, peptides like that. Carolyn, I was on 1.7 on Sema, and I'm up to 2.4, and I have diarrhea since. So, Carolyn, I don't know why they told you to increase your dose, but you're on the maxed out dose. And, when you're on the maxed out dose, when you continue to do this and take this sort of approach, it's kind of crazy why people do that and why clinics do that, but they don't have the thought process or the mentality that we do, which is keeping you guys on the lowest dose possible. So you're getting wrecked by side effects. You're increasing your exposure and risk to complications too as well. These complications are very real. Pancreatitis, gallstones, biliary disease, stomach paralysis. Like, these are no joke things. You want to avoid these as much as you possibly can, and you can do this by just having a more conservative approach. Like, it's not rocket science, but the reason people do the things the way that the way they do it, you know what I mean? So at this point, you kind of have to let it run its own course, but many options would be like a new approach. And that's what I'm trying to say is, if you're working with us, we're going to keep you on the lowest dose possible. Yeah, you're in Quebec. So I know a lot of people from Canada and the UK end up reaching out to us anyways, because they're not getting the guidance that they'd like to get otherwise. Welcome, everybody. If you just joined us, my name is Dr. Jones, and I have clinics, and we service across the nation, all 50 states. I do work with my medical practitioners. They prescribe and I coach. So it's kind of a cool divide and conquer the way that we do things. And so I'm here to train you guys today. This afternoon, I had a cancellation in one of my meetings. And so I thought I'd hop on and help you guys out as much as I possibly can. Samantha, I'm on Mounjaro 15 milligrams. So we got another maxed out dose situation here. I've been wanting to try AOD. I want to know that's what I'm injecting. Okay, so two things. If you're getting AOD from us, then that's what you're getting. And you don't have to get the injections. We also have the troches, which are nice because, you don't have to inject yourself every single day. And you can pop those troches in between your cheek and your gum, and they absorb into the buccal mucosa. But the bigger solution, the real solution to being on a maxed out dose is not just going to be AOD, but it's also going to be lifestyle interventions. So when you work with my clinic and you work with my medical practitioners, user 48, my real doctors, because according to user 48, I'm a fake doctor. So you get to work with a fake doctor and you get to work with real doctors. I think that's a pretty good deal. And So usually what we would do for someone like this is we would, do a medication reset and a metabolic reset. And it's kinda nice because, as a fake doctor, I have, um, coaches that work beneath me and, fake coaches, right? And, so we get to target the lifestyle interventions, and my real doctors are the ones that handle the prescription side of things. Seems to be working out pretty well. Yes, Nunya. These both are me up top. I gotta have some fun with it, guys. I gotta have some fun. Some of these people, I think they're just grumpy. They're grumpy and they just want to be grumpy to other people. So sometimes you just gotta have fun with it. Yes, Samantha, schedule a consultation. I'd love to work with you. I feel very confident that we can help you. What's up, Scott? How you doing, buddy? Um, yeah, with retatrutide, sometimes we're seeing that people would benefit from stacking some cagrilintide with it or Cagri. So you get a little bit of that low dose of Cagri, the low dose of Retta seems to be a good stack. The consultation, guys, is completely free, so it's no charge. It's not a high pressure situation either. You're going to speak with my experts, and if you decide to get started, great. The stack of cagrilintide and Retta is to provide what Retta might be short of. Retta might be short of the ideal appetite suppression that we were hoping. Some people definitely need a little extra kick, and so that's where the Cagri comes in. The reason why we want tirzepatide or Retta as opposed to everything else is because of that extra glucagon activity is very, very important for protecting that muscle mass. Hey, Delia, how are you? How do you avoid pancreatitis? So, yes, pancreatitis is inflammation of the pancreas, and it's one of the many complications that I think people unfortunately don't like to talk about. It's like the elephant in the room. And so, what uh, what we do to help people avoid these nasty complications is our entire approach of keeping them on the lowest doses possible. So, when you stay on lower doses, you are able to avoid and minimize the risk of these complications. Now, how can you do that? How can you make a lower dose more effective? It's simple. You optimize the function of the medication with lifestyle interventions. Uh, Things like low carb lifestyle, keto, carnivore, fasting, weight training. Um, and yeah, so there's a lot. There's just a lot of options in front of you. Hey, Bruno, what's up, buddy? How you doing, my friend? You're done with your reset, and so you are ready to get back on track. I love it. I love it, I love it. Evening, I just signed up for HRT, uh, but I'm really looking for support with hormones and peptides. Did you sign up with us, Alyssa, or did you sign up with another clinic? I'm just curious because we do offer HRT services. So I was just curious if you signed up with somebody else. What's the latest about GLP-1 rumors that there's one better than Manjaro? Yeah, rumors, word in the street is what what people in the know are saying now, like this very exclusive group. Retatrutide. So retatrutide is the triple G, and it does offer, I think, additional fat burning and muscle preserving opportunity. It's got a broader spectrum, a broader metabolic profile, but the downside, it's not really downside, but the things to consider is some people are not getting as much appetite suppression from the Retta, which is why we would recommend stacking it with the Cagri and staying a low dose of either. George, let me know if that makes sense. And, Elio, thank you. I'm glad that you did the reset, and I'm glad that you're at 2.5 and you're feeling really good. So I love it. I love it. Do you suggest Cagri would be better suppression than Turs? No, that's not what I'm suggesting. Turs is great, but when you've gotten yourself into this predicament where you're on a maxed out dose of Tirzepatide, and we have a whole program where we're working with people who are in that situation. So now we got to look for alternatives, and that's where the Cagri and the Retta come into play. Donna, I have a question. I've been on compounded tirzepatide for 8 months, and I've only lost 5 pounds. I'm on 10 milligrams. So the 4 primary reasons why I see people struggle with continual weight loss or losing weight at all are 4 different categories, guys. Elevated insulin levels, inflammation, thyroid, and cortisol. These are the 4 primary categories, and it's like clockwork. It's almost always one of those 4 issues. So rather than continuing to increase your dose if you're working with us, we would try to figure out which one of those areas are a particular roadblock for your body, and we can figure that out with the consultation, the blood work, and yeah, it's pretty dope because once we figure it out, that's when we can start to dial back the dose, which I think long term matters significantly. What is Cagri? Cagri is short for cagrilintide, and Novo Nordisk has a product called uh, Cagri Sema, which is probably going to be available in like another year and a half or two, which is the combination of semaglutide and Cagri. Yes, cagrilintide does help on its own, but I would not recommend it as a solo product. It's more of an optimizer to your GLP-1. It's definitely not a solo product because it doesn't have the metabolic profile. And it's not even technically a GLP-1, although it's close enough in function um, to the same like functions of GLP-1, but Cagri is not a GLP-1. It's actually an analog to something called amylin, which is a hormone that's actually secreted with insulin, and it suppresses appetite. What about a vegetarian who gets a minimal suppression and is at 10 milligrams, no other meds or issues? Well, the vegetarian thing is kind of a separate conversation, but like I was saying, it's likely one of those 4 issues: the hyperinsulinemia, the inflammation, the cortisol, or thyroid. So if you guys want to learn more, if you're curious about what it is that we do, um, and you guys want to get scheduled for a free consultation with one of my experts, shoot us a text message here, and they'll get you set up with one of my experts, and they can go over everything with you. And if you guys do sign up, you're going to be working with me. I will be your coach. I will be responsible for making sure that you kick ass. Alyssa says you did sign up. That's fantastic, Alyssa. Super excited. You have your first discovery call this Friday. That's awesome. Is that your discovery call with Christine, like your admin call, or that's what I'm guessing is that call? That's where she goes over all the admin stuff right after you sign up. Um, yeah, so be careful with all these BPC 157 pills that are available over the counter. Um, you're not getting clinical grade BPC. So I'm not gonna say that they're all completely a waste of money because I'm not gonna say something that I'm not confident is accurate. My gut tells me, literally gut, no pun intended, that there's a lot of cheap knockoffs and people throwing the name BPC 157 on a bottle. And legally being able to get away with that is a whole 'nother conversation because true clinical grade BBC 157, and KPV, the other powerful gut killing peptide, when you're taking real, form, you know, because you're noticing a clinical change. It's not so much pill that I'm talking about, Marina, because we have a compounded BPC KPV pill. So, yes, bioavailability is definitely different with the pill versus the injection, but there's also just a big quality point. Yes, be shorter. That is me on the left. I struggled after I lost 100 pounds when I was 16. That's why I have the loose skin. You can see there that I have the little pockets of fat in my abdomen and my hip, um, the man boobs, all the everything. The man boobs were a big thing too, but unfortunately, I lost 100 pounds when I was 16, and then I constantly struggled and yo-yoed, with my weight. I couldn't maintain the weight loss, which is why I had a lot of loose skin. Yeah, Donna, there's absolutely something that can be done, and there's something to be said about what you're struggling with. So, I would strongly encourage you to reach out to us so that we can, yeah, we can help. We can get to the root cause. I'm currently on a microdose, yes. Yeah, Marina, I've always been concerned about the troches, the effectiveness of the troches, but the ones that we get are very high quality, and, so yes, what they do is they double the dose because you're not gonna absorb as much, right? So it's a 500 microgram troche. If you're injecting, you only need about 250 micrograms. Scott, my man, TRT is definitely, a game changer for sure. If you have low levels of testosterone, TRT is without a doubt very, very important. Lizzie, some say that the troche can take weeks to build up in the system to get to the best results. No, because once it absorbs into your bloodstream, it absorbs into your bloodstream. So there's nothing different about the troche getting through into your blood. There's nothing different about AOD getting into your bloodstream via troche versus injection. AOD is AOD. Now, the only difference is you're not gonna absorb as much in the troche, which is why we double the dose to make up for that. So, one troche versus one injection, you're gonna get the same amount of AOD into your bloodstream, and then the AOD does not behave differently. Yeah, this phone number right here, guys, is actually the best number to reach out to my team. So all you gotta do is just shoot us a text message with your name and your email. You're welcome. Can TRT hinder your weight loss? Um, in a good way, yes. If it slows down your weight loss, it's usually slowing it down because you're protecting the muscle mass on your body. The price is gonna vary on the tropes, but a couple $100 a month is usually, what we're looking at. Usually we're recommending the trochees one time per day. One time per day in the morning to help rebuild the metabolism, become more fat adapted. Yeah, you can totally take the AOD without the GLP-1, but I always recommend that you look at your base fat loss peptides. Like I have category 1 and category 2. Category 1 are the main like the most important thing for the best results. Like you gotta be in a calorie deficit, you gotta work on your insulin resistance. So I always recommend a GLP-1 first, and then category 2, these are the peptides that optimize your results. So AOD, Smorelin, Tesamorelin, CJC, IPA, and, uh, because you can take those peptides Tesamorelin, for example, freaking FDA approved for burning belly fat, but if you're eating like crap, if you're eating like garbage, if you're not in a calorie deficit, it ain't gonna do anything. So GLP-1s, semaglutide, tirzepatide, retatrutide, and then also we have, um tesofensine, which is not a GLP-1, but tesofensine also is in the same category of category 1 because it'll help, uh, put you into this scenario where you're eating less food, you're making better choices, which is the initial trigger for lasting weight loss. What do you recommend to stack with tirzepatide to help with weight loss? Yeah, so we've been talking about it, Alexis, AOD. So AOD 9604 is my favorite option, and it's my favorite option because it mobilizes body fat. And if you have an autoimmune disease, if you have, a lot of stress in your life and you're more sensitive to cortisol spikes, the AOD makes it so that you can actually fast without as much, without really struggle. Are we checking labs for inflammation? Yes. So we do a comprehensive hello, Heather. We do a comprehensive blood panel. Ideally, we wanna do it on every patient, right? You know, it's not a free panel, of course, but, every patient that does GLP-1s with us, we're checking pancreatic enzymes. Without a doubt, we gotta check the pancreatic enzymes, but, um, we're also, for our full complete weight loss panel, we're checking, a functional thyroid panel, so we're doing, free T3, free T4, reverse T3. We are also looking at inflammatory markers, so CRP and ESR. We're also at uh, insulin resistance, so we're checking a fasting insulin and C peptide. King B, I lost 25 since August. I'm on 4 units. Top over last month. I beast in the gym and I've plateaued. Well, I love that you beast it in the gym. Beast mode is definitely a very important strategy, beast mode in the gym, but it's not everything. And so you might need a metabolic and or medication reset. And so that's absolutely something that we can help you out with. So I would shoot us a text message here in order to get yourself scheduled for that free consultation with one of my experts. You're welcome. What does a low TSH mean? So, usually low TSH is more of a hyperthyroid situation. But without the other labs, you won't know this for sure. So you gotta check that out. You're welcome, King B. I have a huge bruise after injecting Mounjaro before my belly. Should I worry? No, I mean, no, depends how big the bruise is, I guess. But if the bruise isn't getting worse and it's not continuing to happen, then I wouldn't worry. Hey, Ginny is watching from Stillwater, Oklahoma. That's awesome. Yeah, no worries. I got about 5 more minutes anyways. So currently on Retatrutide, I don't wanna increase the dose, but I want to start Tirzepatide. So what's your goal? I definitely like the idea of making sure that you do stay on the lowest dose possible. That's always my goal too as well. What's the best way to start doing maintenance when you're on a GLP-1? Let's see. What's the best way to start doing maintenance when you're on a GLP-1? So, truthfully, the best way to go about this is it's all about your approach. You don't take a GLP-1 medication and then go, "Okay, how can I maintain weight loss now?" No, 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 that's not how it works. You could certainly do that, and we're gonna help you if you're struggling at that point, but what you need to be doing and asking yourself during your weight loss journey is, "What do I need to be doing now?" Because it's what you do now during the weight loss that sets you up for success later on. So, it's the permanent replacement of the medication with lifestyle interventions. You guys like this background? We can change it up here too. Let's check this out. Boom. Get some blue going on here. Let's see. And then we can do, this as well. Let's see. Is it normal to be on week 3 of 5 of Mounjaro and gain 3 pounds? So the, no, it's not. Now, I always tell patients not to one freaking out about 1 week where you don't have weight loss or your weight goes up a little bit. I wouldn't freak out about that. 2 to 3 weeks where you're not losing, yes, that might be an issue. Does anybody have any recommendations on where to get AOD? Alexis, you get AOD from us. You get your AOD from us without a doubt, and you're gonna get high quality AOD. You're gonna get the coaching, the guidance, the support, all the above. Robin, just got my first prescription today, going to fill tomorrow. Low and slow, super stoked, Robin. That's fantastic. Who are you working with, if you don't mind me asking? Tirzepatide not available here in Canada for weight loss. Gotcha. You have access to, Robin. Jay-Z, I've been on 2.5 of Tirs for the past 4 weeks. I've lost 25 pounds. I'm in the gym 5 days a week and doing intermittent fasting. Love it, love it. Am I losing fat too quickly? 25 pounds in 4 weeks sounds like a lot. Usually what I recommend is shooting for about 1% of your body weight lost per week. 1%. So it sounds like that might be, a little too much, but, think with that. Jeans, I'm glad that you got your questions answered. Guys, I'm about to hop off here. Any last minute questions before I let you go? Remember, guys, I do go live every single morning. You guys can catch me Monday through Friday, 5:30 a.m. Mountain Standard Time. You can catch me on the weekends at 7 a.m. Uh, make sure you're following my YouTube and my podcast as well. There's a ton of free information and really good resources there. All the topics that I talk about here, you guys can get every single question answered. Sorry, Jesse, I'm not going to answer your questions. I'm just kidding. Let me scroll back and see, what did Jesse ask? I don't actually see. Oh, here we go. Is it normal or is that genes? Let's see. Jesse, somebody can you pin Jesse's question? Because I don't see Jesse's question. Oh, what does AOD do when taking with Zepbound? So AOD mobilizes the fat. So essentially, what that does, in summary, you're going to protect your muscle mass so that the weight that you're losing is primarily fat and not muscle mass. That's really what it's going to do. And so if you guys want to learn more, if somebody can pin Jesse, yeah, Jesse, I don't see your question there. If you guys want to learn more, and you're sick and tired of being sick and tired, uh, this phone number right here, all you got to do is shoot us a text message and get yourself scheduled for that free consult. Jay Z, I was 349 and now I'm 324. So 3 pounds a week, 3 to 4 pounds a week is definitely the most I'd want to see you lose. So yeah, you're definitely losing pretty fast, Jay Z. My concern would be muscle mass loss as well as loose skin. So we definitely probably would want to focus on increasing your protein intake and increasing your training so we can really continue to dial in those results. All right, you guys take care. Have a great evening, everybody. I'll see you later.